Hello you! So I said I'd catch you up on where I am with things. For anyone who doesn't know, I know lots of you, my name is Leah and I have cancer. I have leukemia. And at the moment I am struggling with a lump that is on the back of my right ear. I've been to see a head and neck surgeon who said it is nothing, although by his own admission he knows absolutely nothing about my type of leukemia or how it can affect the bones. I wasn't happy with that, as there were no images taken, there was no bloods, there was nothing. It was a very quick consultation, a very quick examination. So I've been back to my GP and explained why I'm unhappy. And he gave me another examination and said, yeah, it's grown. And so has sent me to a different head and neck surgeon at a different hospital. So I'll be waiting in the coming week to find out when I'm seeing this new person. And one that certainly I've learnt from, which is read the paperwork, even if you don't think you'll understand it. Just give it a going over. In the UK, once you've seen a hospital doctor for whatever reason, your GP gets a letter to explain what was done and why and all the rest of it, and you get a copy of it. And normally I don't really read those. I kind of give a glance to them and then sort of close the email. My GP had read it though, because my GP is wonderful. And what they do in the hospital letter often is they will list it near the top, your previous medical history, or PMH. And under my previous medical history it said ovarian cancer. It talked about previous ear surgery I'd had, and it said Langerhans cell histiocytosis. And as my GP said, that's not previous, that's current. Previous medical history are, I broke my collarbone when I was 17. I don't know. Surgery on my knee 7 years ago. It's not supposed to be things that you currently have. That's part of a different section. Now, that explains a fair amount about the consultation. It explains why the lymph nodes that are slightly up in my neck were never examined. It explains why it was a cursory. Because, as my GP said, he may have been looking at me as if to say, well, my GP sent me because he was concerned it might be cancer, and it's not, so there off you go. He wasn't examining me as though I was a current cancer patient. Now, part of me wants to make an awful lot of allowances for that, because we all make mistakes in our jobs, we all have bad days. And then I thought, well, but you didn't read the referral, you didn't listen to me because I'd said it as well. You just made an assumption based on, I don't know. I mean, maybe he did look at the referral but didn't read it and saw Langerhans. So the GP said for that reason alone it would be worth me seeing somebody else. Now that somebody else may, on investigation, having done whatever test they need to do, come to exactly the same conclusion, in which case it is indeed a Merry Christmas for me. But if they don't, I need time to process and evaluate treatment options and work out what the heck's going on. So this short one is just a reminder of mistakes happen. I have seen countless other YouTube uploads which have talked about mistakes happening or doctors jumping to conclusions which turn out to be incorrect. People being told it's all in your mind when it's a lump. I do feel that it explains that the combination of what I experienced at that consultation was probably a mixture between being gaslit and being fobbed off. It amounts to the same thing. The stakes are high. We are not talking about a broken arm. We're talking about something that's not only life-changing but life-threatening. Your life and my life is worth a huge amount more than that. And so it is not difficult or stupid or, you know, I don't know anything compared to this person. Doesn't matter. Check. Please, please check. Because had I just gone away with the information I've been given, if I didn't have a GP who would religiously read through everything, I wouldn't be getting my second opinion, which is effectively what it is. So I implore people with cancer to, I'm not suggesting you try to become a professional oncologist or disregard what's being told to you by professionals, but for goodness sake, check if it doesn't feel right. Because in my experience so far, the professionals that are really good and really valued are more than happy to explain their thinking and how they came to those conclusions or why they've made the recommendation that they have. More than happy to do it. There are also charities which are connected to your particular type of cancer, and in the UK there are charities like Macmillan where you can speak to a nurse and they can't give you one-to-one advice, but they can give you generalised advice where they can take the time to explain things to you, answer questions. Please, please take advantage of those, because I think the worst horror, hey, nearly Halloween, so that was a bit of a fortuitous thing. The real horror for a cancer patient is being told, yes, it is cancer, but you've caught it too late. And there's nothing we can do. Don't be in that position when you don't need to be in that position. If something doesn't feel right and you can't go back to the consultant or your CNS is not as available as they should be, or you find it hard to talk to them, find somebody like Macmillan. One of the charities associated with your cancer often has a helpline where you can ring and ask them such questions, or your family doctor. Good luck with that, and I will let you know how things are going, and hopefully bring you something that's a bit broader, because I've ordered new glasses so that I'm not going to be in such pain trying to do these uploads, because filming at the moment is a bit of a nightmare. I've tried without glasses. I'm sort of squinting like this. So yeah, so next time you see me, hopefully I'll have my new glasses, and yeah, we will see each other soon. Thanks ever so much for your time, and I really hope you take care of yourself this week. Cheers.